Welcome back. I hope you enjoyed the hands-on sessions this morning. Probably you've already scanned through various organs in the gastrointestinal tract. And fitting to that, our next speaker will talk about abdominal pain, which is a common cause for consultation in general medicine. Dr. Oliver Lammel has a practice for general medicine in Ramsau am Dachstein, and he's a general practitioner and a specialist for internal medicine and emergency medicine. Thank you so much for coming to Graz.
Can you hear me? Great. Thank you so much for your invitation, and I'm quite happy being with you. My name is Oliver Lammel. I'm a rural general practitioner at Ramsau am Dachstein. I graduated here at Graz in 1996. And after my basic rotations at Schladming, I worked as an emergency physician at the flight base C-14 at Niederöblan. Due to the lack of free GP positions at that time, I underwent the training to become a physician. So that's my basic information. In 2011, I had the chance to build up my own practice at Ramsau. That's a picture of my practice. And, well, that's, I'm really a rural GP in an alpine region. That means that's a quite touristic region. And, well, we have enough patients to take care of. We've got, this is a picture 2 years ago. We had a lot of snow. Even for home visits, it was necessary to take the skis with. Well, I often tell you I'm a GP 2.0. What does this mean? The time is over to work only with blood pressure measurements and stethoscope. You see, we have some more tools. That's an ECG, and of course, for blood picture, that's for check the urine, that's for D-dimer and troponin tests, CRP level is this. And of course, we have an ultrasound machine as well. So it's a pleasure to talk to you about abdominal pain. Well, I brought some hopefully exciting cases with me from my own practice, of course. I call this case a late summer surprise, according to the theme, late summer school. And this is the story of a 15-year-old girl or woman coming to me and seeing me with leak edemas and diffuse abdominal pain. Basic information, she has no fever, temperature has been 37.2 degrees, blood pressure 90/60, pulse rate 110, heart and lungs, no findings, but leak edemas. Well, I was sitting and thinking, well, what could this be? There are lots of differential diagnoses with diffuse abdominal pain. Too much or not? What to do? Too many possible diagnoses? Send her directly to the hospital without thinking? No. We took our ultrasound machine and then we saw this. Nothing to see. And when we took our probe over her abdomen, well, this could be some fluid, I thought. What could this be? There are signs of bones. Perhaps you can see something. That's the head of her baby. So the reason was she has been pregnant. Yeah, a very difficult situation for a general practitioner, of course, because she pretended nothing to know about this pregnancy, and I was shocked about the diagnosis. I talked to her and said, "Yeah, wow, you are pregnant. It couldn't be true." And I was thinking, what should I do now in this situation? 15-year-old girl. She is a waitress at one of the hotels in my village, and that was really a challenge. Okay, there are only two important things for a GP. Is this an acute situation? That means, have I sent somebody to a hospital, what I don't like, or is a watchful waiting possible? In Latin, diabolus numquam dormit, the devil never sleeps. Another second case, another summer surprise, okay? It's a 29-year-old woman, a colleague, a doctor lady, coming to see me with nausea. That was the only symptom. And her findings: no temperature, normal blood pressure, pulse rate 70, heart and lungs, no findings, no edema. What to do? Too many diagnoses, nausea, sent to hospital. Of course not. We take our ultrasound probe. Is this acute or not acute? Nausea. Well, we have to find out what's wrong with her. And same history, that's also a pregnancy. That's caused. And she was quite happy with this diagnosis. Abdominal pain, as I showed to you in one of the first slides, there are so many differential diagnoses what we have to think about. It can be epigastric, it can be a cardiac reason, acute coronary syndrome, or myocardial infarction. It can be a biliary-caused cholecystitis, cholangitis. It can be the cause of pancreas, a pancreatitis, aortic dissection. It can be a simple gastritis or early appendicitis, epigastric hernia. So there are lots of things can be the cause for abdominal pain. In the right upper quadrant, it can be a pneumonia or a pulmonary embolism. Biliary, again, cholecystitis, cholangitis, hepatitis, or hepatic abscess. You see, I don't want to talk about all these diseases. There are lots of things we have to check out. And with our method, and I'm glad to see so many people doing ultrasound, we can exclude most of the diseases. A winter surprise. That's the story of a 32-year-old man. He is complaining about a pain at the left side after a ski accident yesterday. So the findings: temperature 37.4 degrees, blood pressure 80/60, pulse rate 120, heart and lungs no findings, but he looks pale. Okay, what can we see there? It was so exciting for me that I only pressed the record button. That's the spleen there. And that's, you learned all black things can be fluid, and it's free fluid. So is this, well, another picture. That's the bladder. and epigastric. The probe is epigastric, and beside the bladder you can find also this black thing, free fluid. So is this acute or not acute? Of course, acute. Is it dangerous? Of course, very dangerous. We took blood and the HB is only 6.0. So it's highly dangerous. Sometimes other examples of free fluid, sometimes it's only a small amount in backside of the bladder, Douglas space, and sometimes it's quite a really small amount. Another winter surprise. This is the story of a 62-year-old German lady. As I talked before, we have many tourists, and she is complaining about a pain at her right side. It occurred after dinner yesterday evening, day before. What can we find? Temperature 38.7, blood pressure 160/95, pulse rate 125, heart and lungs no finding, but a defense at the right upper quadrant. Question, acute or not acute? Of course, that's acute. Yeah. And we can see there's the gallbladder. And what you can see is this small black layer. This small black layer is also fluid between two layers of her gallbladder. And that's the ultrasound finding of an acute cholecystitis. There, perhaps the other layer, you can see this black free fluid around the gallbladder. Acute cholecystitis. What can we find at the lab? You see the white cells count, white blood cells. There, it's elevated. And we did CRP level as well. It's 129, it's also elevated. So this fits with acute cholecystitis. What can we do? Send her to hospital or not? That's every time our question. Another case with cholecystitis caused by stones. Infection lab with a finding of ureter flow. There's no need to send this patient to the hospital. Next case. It's the case of an 82-year-old man. Pain at the right side. Atrial fibrillation and hypertension is known. Okay. Findings, no temperature. Hypertension is known, but blood pressure is low. Pulse rate, atrial fibrillation is known. Pulse rate is high. Heart and lungs, tachycardic, arrhythmic, and a murmur at the region of the aortic valve. Crabs over both lungs, and he is also pale. Acute, not acute, every time same question. Second question to the hospital. Okay, we need a help from our friend from the probe, and then we will find this. It's not isoechogenic. That means there are different colors. I always tell it's color, but it's only gray, different grays. Dark grays inside and black things inside. But it's obviously, there is a layer around this. Okay. there is more. That's the other layer. I turned the probe, and it's huge. Yeah? There you can find the measurements at the bottom. It's more than 10 centimeters. Wow. That's the ultrasound picture of an hematoma. It's a spontaneous hematoma. We've seen before he has got atrial fibrillation, so he should be anticoagulated, and that happened without any trauma. So we sent, of course, this patient to the hospital, and there was no intervention necessary. But very helpful to find the diagnosis with ultrasound machine. Next case. It's the case of an 80-year-old woman. Pain at the right side, dyspnoe. Also atrial fibrillation and hypertension known. No temperature, hypertension known, low blood pressure. Pulse rate 115, heart and lungs, tachycardic, arrhythmic. Of course, we heard an atrial fibrillation is known. Also murmur at the aortic valve that we often find with elderly people. Traps over both lungs. We wrote an ECG, atrial fibrillation. And we can find this to explain what we see there. That's the liver, so we are quite high, and that's easily to do. That's fluid between lung and liver, so it's a pleural effusion. So she is cardiac decompensation. It's a cardiac decompensation. Acute, not acute. Second question to the hospital. Well, she's quite stable. Perhaps we can take care of her and try to give her some diuretics, and we will check if we closed out other dangerous things, we can send her home and give her a new appointment within the next 2 days and check if this pleural effusion is gone or not. Right lower quadrant, all the first cases were up. We go a little bit down. Right lower, we know appendicitis, cervical obstruction, ileitis, diverticulitis, all these chronic inflammatory bowel diseases, ulcerative colitis and Crohn's disease. It can be from the urinary tract, can be ectopic pregnancy, hernias, psoas abscess, and lymphadenitis are very common with with children. On the left side, also these chronic inflammatory bowel diseases, urinary tract, as we heard before, ectopic pregnancy, psoas abscess, etc. And suprapubic, also appendicitis, diverticulitis, Crohn's disease, ulcerative colitis, or something in the urogenitalic tract, hernias. Next case. It's a young guy, 18 years old, nauseous, little pain in the right lower quadrant. So we find his findings, temperature 37.9 degrees, blood pressure 110/80, pulse rate 80, no findings at heart and lungs, but defense at McBurney's point. We know McBurney's point is the line between the spina iliaca anterior superior and the belly button at the first third. And this is a typical point for acute appendicitis. And what do we find? This is also free fluid at this point, and this is the appendix. Appendix can be found best ever when inflamed. That means when we have some free fluid, then we can find this easily, yeah, as in this case. Or I guess this is another guy, also with acute appendicitis. There we found this free fluid and the appendix there. Or this case, appendix, good to see, and free fluid. Next case, it's a 38-year-old woman, pain at the left lower quadrant, diarrhea, no allergies, no medication known, temperature 37.7 degrees, blood pressure 120/80, pulse rate normal, no finding at heart and lungs, defense, left lower quadrant. What's the most common reason of pain in the left lower quadrant? Diverticulitis. And we found this. That's not a diverticulitis. This is a colitis. What does a colitis mean? All the layers of the bowel are bigger than normal. We found normal size are 3, maximal 4 millimeters, and we see there that's 6.5 millimeters. Most common reason for this is an infection. Also could be a chronic inflammatory bowel disease, of course. Is acute to the hospital. We need more investigation, so we throw blood and we find elevated white blood cells and elevated CRP level. This is a common CRP level for bowel inflammation. 3.1 or 31 milligram per liter CRP, it's common. It's not at all a dangerous sign. Next case. It's a 48-year-old man with pain at the left lower quadrant, diarrhea and loss of weight, no allergies, no medication. Loss of weight is a red flag sign. Temperature 36.7 degrees, normal blood pressure, normal pulse rate, and no finding at heart and lungs. Is this a normal liver? I don't think so. It's irregular. It's not the normal gray. It doesn't look good. And when we look exactly, we can find these pullet lesions. There more. And this finding at his, it was not at the appendix region, quite higher. It's, let's call tumor at the colon ascendens. It was an, and it's, I'm deeply sad because that was a colon carcinoma. He died in the middle. That was in last year. He has got 6 months left after finding this at a weekend duty. Next case, a 58-year-old woman, pain in the left lower quadrant, also loss of weight as a red flag sign, no allergies, no medication. Then we found this. Is this normal in the liver? Of course not. There, it's also a huge metastasis. And that's the reason, that's at her right breast. It's a mamma carcinoma. When you work as a rural GP, people come often too late. I don't know why, or come with specific question that you wouldn't see at a city in a GP setting. Next case. It's a 72-year-old man, cannot pee anymore. Okay. We look to suprapubic and we see it's a huge prostate. So normal size of a prostate is 4 centimeters, and that's hypertrophic. So that's the reason he can't pee. We put him, it was 2 weeks ago, we put him a catheter in, and he will be seen tomorrow, on Monday, by a urologist. That we will find in his urine leukocyte and blood, so it's an infection as well. So the reason he can't go pee anymore is an infection and a huge prostate. So we can treat this infection. Perhaps we can try to put the catheter out, and perhaps he can pee afterwards, but he has got an appointment. And the urologist often says, let a catheter in that the bladder can cure and is better for the patient. By going, he told me, I have my, I'm the grandpa of a 5-year-old girl. She fell on her hand yesterday. Do you think that ultrasound can help you in this case? Yes or not? Who is for yes? Okay, good. Yes, of course. We have the possibility to, that's the bone line, and you see there's a distance, so it's a fracture. Some other pictures of fracture here. Here, it's a huge distance between. Here, good to see. Here. So I often use ultrasound to detect a fracture as well. It's easy to do this. Next case, it's a 75-year-old man. He's got a lump at his right lower quadrant. Past medical history, hypertension, central vein occlusion, right eye, obesity. But this doesn't matter for our case. What findings? No temperature, blood pressure slight elevated, pulse rate 75. We find this lump at his right side. We thought perhaps a hernia, something else. It's without any pain. But we will find this at his right side. Okay, let's try to solve this. Does it look regular? Of course not. There are also different gray, 50 shades of gray. And it's huge. It's 3.7 centimeters and nearby 6 centimeters on the other layer. Well, we find this. What are our next steps? What can we do? We can do a lab. Well, to find what? Yeah, there are many labs are providing, when we thought perhaps it's a lymph node, we can do, they provide some blocks, lymphadenopathic block. We can do an MRI. We can do a thin needle puncture, or directly to the surgeon for an operation. Okay. What did we? In the MRI, we sent him to the MRI. He told it that, of course, it's a sarcoma. Sarcoma, very, very dangerous. In the lab, it was a normal lab. There wasn't any finding. At Salzburg, there is a pathologist also in free practice, and he does this thin needle punctation. He learned this at the Karolinska Hospital in Sweden. There are not so many pathologists who do this, who perform this. He is a specialist in thin needle puncture. He was telling us, oh, it's only a hematoma. So, well, not at all. We sent him to Graz, to the orthopedic department, and they performed, or they got a huge biopsy, and they also find, well, it's only hematoma, but they thought, no, it should be more, it's so irregular, and they operated him, and they really find it's a hematoma, and they performed a PCR from this sample, and in the PCR they find Bartonella henselae. What's this? This is the bacterial cause it cat scratch disease. It's a rare disease, but he got this. But inside this huge operation sample, the pathologist also find metastasis of malignant melanoma. So this guy is now on treating. The treatment of scratch disease is easy. It's antibiotic. The treatment of this melanoma metastasis is very difficult because we haven't found any primum. It was only lucky guy only by doing this operation. He's still on treatment. Next case, it's from a 55-year-old man with a suprapubic pain. There was, due to an bladder cancer, cystectomy 3 months ago. And we find nothing in the urine stick, but we find this. Is perhaps this a recidive or something else? That's a seroma after operation. The urologist, that's what often occurs. Next case, it's a 35-year-old woman, also pain suprapubic. She feels sick. Okay. Temperature 37.1, blood pressure 90/60, pulse rate elevated, heart and lungs no findings, but she's really in pain. Urine stick, some leukocytes, some blood, not really much. And we find this. So that's the uterus. What's this inside the uterus? Somebody knows? What could this be? Yeah, exactly. But what's around the uterus? Free fluid. The black thing is free fluid. That's the bladder, uterus, and that's free fluid. So what could this be? One test has been performed. We can think over, can we get pregnant also when we have this contraception? Of course, yes, it's all possible. It's an ectopic pregnancy. And this ectopic pregnancy caused this free fluid we found around the uterus. So this is also very, very dangerous. We sent her to the theater, operating theater. We come back, a late autumn surprise. The late autumn surprise is a 15-year-old woman with sore throat and she feels sick. That's what we commonly see in our practice. That's her finding: slight elevated temperature, blood pressure, pulse rate, normal, heart and lung, no findings, slight elevated pulse rate, what we often find. And we look at her throat, so we made a diagnosis. That's for us angina tonsillaris, and we put her on antibiotics. Okay. 2 days later, she comes again, feeling worse. Temperature still elevated, blood pressure, pulse rate as before, heart and lungs, no findings. What could this be, and can our ultrasound probe help us? Yes. When patients get worsening advice, that means when they don't feel better after 2 days, I often say, when you don't feel better after 2 days, I want to see you again. And then it could be another disease, also often to see in general practice, also with sore throat and with these plaques on the tonsils. That's kissing disease. Do you know what this is? Of course. And is the ultrasound probe helpful in this case? Yes, we can take a look at her spleen. And the spleen is bigger than normal. What's the normal size? Normal size is maximum 11 centimeters, and we see that's 14 centimeters. So it's huge. So we send to the lab, and the result comes back. It's mononucleosis, kissing disease, or Pfeiffersches Drüsenfieber. Good. I'm at the end, hopeful that was some exciting cases from the general practice. Our take-home message: ultrasound gives us an easy access. We get a steep learning curve. You will see. You do the right thing, you learn, and you get a steep learning curve. You should perform this. It's no radiation exposure. Wonderful. It's cheap. I've seen the picture of Mides. There are so many old ultrasound machines. They are really cheap. Yeah? It's not necessary to get a high-end machine. You can do everything what we've seen here with a simple ultrasound machine. The access is easy. And we have the chance to get second-hand machines. And it's really a great diagnostic tool. You do the right thing. Thank you. Any questions? No question? Yes. It's not always. Sometimes you see that the wall is bigger than normal. The clinic examination, and perhaps you throw blood and do the infection signs, will help us and lead us to the diagnosis. And of course, when you go with the probe in this region and you put the probe on and it's exactly there where you find the appendix, well, what's then? It walks like a duck, it looks like a duck, then it is a duck. Yeah. I didn't send him to the hospital. I put him on a drop with some spasmolytic thing inside and put him on oral medication afterwards and checked him every day and told him he should check his urine with a filter, and he brought me about 2 millimeter big stone, and that we sent to the lab, and it's often oxal salicylate stone, and well, he cured himself. There was no need for the hospital.
On average, how often do you use the ultrasound a day?
5, 6 times. And well, I do also some health investigations, some health examination for health people. There I do also ultrasound, so perhaps more, depends.
There's another question over there.
It's not necessary to press on. You put the cream first, and then you go slightly over the skin, and that's enough. So normally they have not more pain than before. But it's really helpful. You've seen that's easy. You see the bone line and then the interruption of the bone line. So it's really easy. And also the picture of this pleural effusion. That's so easy. You can perform this next time, put this on, and in a second you've got a diagnosis.
Are there any more questions? Okay. Thank you so much for your interesting lecture. We have a little gift for you.
Oh, that's cute.
And thank you again so much for coming to class.
Thank you, and you are all doing the right thing. Medical studies, you got a great future, you do the right thing, and general practice is amazing. It's wonderful, it's brilliant, I like it. I like my job. Much more than in the hospital before. I'm free, I'm doing my appointments, time, I do everything by my own. Yeah. So I want to tell you, general practice is the best of everything.
Thank you.
Thank you. Thank you.
So that was it for the morning session. We hope you enjoyed it so far. And we'll now get into a lunch break. Please be aware of the corona regulations. So keep your distance, wash your hands regularly, etc. For now, please remain seated because your lunch will be distributed in here. And after the lunch break, we'll meet again at 1 in the hands-on sessions, and enjoy your break.